So we are going to talk today about cardiology. We will talk about the first part, that is cardiac murmurs. Cardiac murmurs are mainly the mitral stenosis, is the first murmur, which is a mid-diastolic at the apex, best heard with the bell, with pre-systolic accentuation, with a loud first hard sound. Then we have mitral regurgitation, which is a holosystolic, best heard at the apex, radiates to the axilla and increases on expiration. Then we have mitral valve prolapse, which is a mid-systolic click followed by late systolic murmur and increases with standing. We have tricuspid regurgitation, which is a holosystolic lower left sternal border murmur, which increases on inspiration. We have then ventricular septal defect, which is a holosystolic murmur, best heard in the lower left sternal border, which increases on expiration. Then we talk about aortic stenosis, which is a mid-systolic, crescendo-decrescendo, best heard in the upper right sternal border, which radiates to the carotids and increases on expiration. We have then the murmur of hypertrophic cardiomyopathy, which is a mid-systolic, best heard in the left sternal border, which increases with standing and there is no radiation. As you can see in the murmurs that we have already described, there are three murmurs that are holosystolic, like the ventricular septal defect, tricuspid regurgitation, mitral regurgitation. How do we differentiate between these three murmurs? Well, because mainly we have to remember that the murmur from, for example, tricuspid regurgitation is a right-sided murmur. And this murmur increases on inspiration, while is exactly the opposite for mitral regurgitation, because it's a left-sided murmur which increases on expiration. So this is the way to distinguish both of them, tricuspid regurgitation, mitral regurgitation, also depending on the radiation, because mitral regurgitation also radiates to the axilla. Now we try to examine other murmurs just to see all the, and then we see all the differences, how we can differentiate between all of them.